And we're live on YouTube.
Good. Hello and a very warm welcome to all of you listening to this beginning and starting webinar of the project People, Planet, Health. We are very, very happy to have such a big audience from all over the world, and I would express my very warm welcome in the name of the group to all people listening on Zoom and all people listening on YouTube. We saw that even from Australia, are people listening, which is not really the comfortable time to attend a webinar. And we saw that there are people from all over the world. Thank you very much for participating. I will now give you a very short overview about the program we have today, and then give over to our speakers. Could I have the next slide, please, Patricia? Thank you. So we will start with Dr. Rüdiger Krech, who is Director for Health Promotion at World Health Organization, WHO. We are very pleased to have this great support from WHO. And thank you, Dr. Krech, that you will do the first session and give the frame for this very exciting starting event. Then I will give you a short overview about what is the program and the project and the initiative about. And then Jake Salloway-Costello will show you through the website where you will be co-creator of a position paper. We will explain to you how. And then we will have 3 invited guests from Uganda, from the UK, and from Egypt, which are Winnie Appiah, Jake Brown, and Omnia El Omram, who will tell you what kind of grassroots organization they represent and why they participate in the program and what they think they will benefit from it. Then you will have the opportunity to receive answers to your questions. For putting questions, making amends, or giving additional ideas, please use the chat function on Zoom or on YouTube. Patricia da Silva and Lian Como will gather and collect all these questions and put them at the end of the webinar. The very end will be again a word from Dr. Krech from WHO. So I welcome you very much, Dr. Krech, and please, the microphone and the stage is yours.
Thank you very much, Claudia, for this kind introduction. And ladies and gentlemen, dear colleagues and friends, it is a true honor for me to address this meeting on the issue of planetary health and how health promotion can play a key part when we build back better our societies and prevent the world, hopefully, from a next pandemic. Human health is interconnected with the natural environment. We know this for many years, but we haven't aligned our policies with this fact. We now have received the bill for this failure. Health promotion has been a driver for public health for many years. Just think of our action areas, such as building healthy public policies, which in today's language is called health in all policies, or our approach to community engagement and participation, which is truly in our DNA, and our efforts to reorient health services so that health professionals are the best advocates for creating societies in which healthy choices become the easy ones. The COVID-19 pandemic is perhaps the last wake-up call for the world to understand the importance of health for the way we design our societies. Some economists estimate the overall costs as of today at $7 trillion US, which now exceeds 2/3 of annual global development product. We now see that health impacts all walks of our lives. Health impacts mobility, trade, the service industry, banking and finance, employment, our social and cultural lives. And we start to understand how fundamental this global societal disruption is if health impacts of policies are not considered. It would be a huge mistake if the world would not learn from this crisis and fundamentally address existing weaknesses. Other crises, such as H5N1 12 years ago, H1N1 10 years ago, and Ebola 5 years ago, could have served as wake-up calls. Unfortunately, the world reacted with relatively small adjustments. The recommendations of a range of expert committees that unanimously called for health in our policy approaches to assess health impacts and risks that could lead to future outbreaks were not implemented. I had the privilege to serve as the lead of the Secretariat of the Review Committee of the International Health Regulations in 2015 and saw firsthand how united researchers were in their assessment. Health promotion can be a driver in a fundamental review of how societies can be redesigned to address both sides of the same coin. How to prevent risks that would lead to a next pandemic, and how to create a world where all people enjoy healthy lives and well-being, living in a healthy, safe, and supportive environment as members of an inclusive society. What are the core dimensions of future health promotion? Firstly, let me say how valuable our work is on health literacy, global health diplomacy, our work in creating health in the settings of everyday life, such as healthy cities, health promoting schools, enterprises for health, healthy regions, islands, and prisons. Health promotion is pivotal in the work with vulnerable population groups. And let us not forget that we paved the way for the work on social and commercial determinants. Just look at the definitions and for universal health coverage. There has been tremendous learning in our work. For instance, we understand today that what we called prerequisites for health in the Ottawa Charter can be influenced and are not unchangeable conditions and resources that need to be in place before health promotion action can be successful. We understand today that we need to be centrally involved. We learned that peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice, and equity need and can be influenced by us. There has been tremendous learning in building social environments. People need people. Health promotion is based on social support. The way we design health promoting settings has at its core that social interaction is fundamental to good health. We could learn from this right now in the COVID-19 response. We see the huge mental health problems that are occurring. And we also see heartwarming signs of solidarity across the world. But what does this mean in today's and tomorrow's world? The potential of reorienting the health system is enormous. At least 50% of the global disease burden could be prevented through ensuring healthy environments, safe and supportive societies, and investments in disease prevention and health promotion to ensure healthier lifestyles and reduced risks. Unfortunately, this potential is not realized by global health investments. Investments in broader population-based disease prevention and health promotion programs are underfunded even though they yield high returns. For example, WHO's best buys for non-communicable diseases include cost-effective policies to reduce tobacco and harmful alcohol use, address unhealthy diets, and increase physical activity, even though they provide returns on health many times over. For just $1.27 per capita, these interventions could be scaled up to reach 50% of people in low and middle income countries, yielding a return of $7 for every US dollar invested. Access to improved sanitation is another example. It provides a return of 5.5 US dollars per dollar invested, and yet some 2 billion people worldwide lack access to basic sanitation, while diarrheal disease remains one of the biggest childhood killers. Increasing spending on prevention and health promotion with a focus on cost-effective solutions will help to improve health outcomes, reduce healthcare costs sustainably, and contribute to broader social, environmental, and sustainable development goals. Ensuring health and well-being in the 21st century requires us to address health in the context of the major global transitions in demography, urbanization, energy use, and climate change, food systems and nutrition, epidemiological trends, and rapid technological change. In addressing these transitions, we need to be proactive, not only mitigating risks after they occur, but also proactively bending the curve of trends to reduce health impacts and optimize co-benefits. Just as an example, in developed countries, some 50 to 70% of people with internet now go online as the first point of health information in developed economies. In developing countries, smartphone ownership stood at 42% in 2017, and social media use continues to rise. Artificial intelligence and digital health can serve as important tools for improving data collection and triage, training, predicting future health events and risks, as well as behavior change. Nevertheless, privacy concerns are also a key digital health issue, and social media can have negative impacts on mental health. There is vigorous debate over the safety of some new technologies, such as 5G telephony, with e-waste created by throwaway technologies constitutes a growing environmental health threat among the poor of the world's sprawling cities. Clearly, these transitions are all closely interlinked, as are the economic, environmental, and social systems that underpin the way our societies function. And these transitions all have both positive and negative health impacts. As a health promotion community, we can actively support policymakers who design the legal marketing and trading frameworks for goods and services, what is healthy and what is not. In disease prevention, we often tell people what they should not do. Don't smoke, drink less alcohol, eat less sugar, and less fat. In WHO, we are actively supporting pension funds from disinvesting from tobacco. We are working with governments to raise taxes on tobacco, alcohol, and sugar-sweetened beverages. We are working with governments to ban tobacco advertising, limit alcohol sale, and negotiate with soft drink companies to lower their sugar concentration in their products. Colleagues, in disease prevention, we are often spoiling the party for many investors who want to make a quick buck. But going forward, we need to throw a new party. In health promotion, we are looking at the things that positively influence population health. For example, sovereign wealth funds, pension funds, and impact investment funds collectively manage about 52 trillion US dollars in assets. Allocating a portion of these investable funds to investments that are positively impact health will certainly contribute to healthier populations. Identifying those investments that are good for global health helps to reduce the currently high costs for individuals, families, communities, society, the economy, and the planet that occur through current investment policies. Going forward, we will be engaging multilateral developmental financial institutions, the private sector, capital markets, and the banking community to ensure that borrowers adhere to activities that promote health and well-being. For example, large infrastructure projects are currently not done with active transport, such as walking and cycling, and road safety in mind. Using fiscal and legal tools, one can develop a system of incentives and disincentives with appropriate risk-sharing arrangements to encourage health-promoting lending policies and practices. Going forward, we will be engaging regulatory authorities, including banking and securities regulators and investment authorities, in sustainable pro-health market shaping policies. We will assist them to provide regulatory incentives and disincentives to entities under their jurisdiction that will promote health. This includes providing regulatory incentives to the institutions that have a positive impact on the common good. For example, investors that comply with environmental, social, and governance and health criteria. Banks that lend to health-promoting industries would be subject to lesser regulatory reserves. Environmental regulation would be structured such that the true costs of environmental impact is reflected in the cost of a project, including the application of the polluter pay principles. Fiscal incentives, such as subsidies or tax breaks, would only be provided to health-promoting industries. Going forward, we will be engaging partners to advocate for corporate governance reform to make the board more accountable for actions that impact on public health. Multinational corporations are among those selling health-harming products and should be made more accountable for their actions. WHO supports those corporations that move away from a shareholder-centric position to one that takes into consideration other influences, such as population health gain. While we acknowledge that this is a very different way to look at business, business leaders increasingly see the value that stakeholder value offers huge potential to drive very different strategies and outcomes. Emphasis on short-term financial returns should be discouraged, or more long-term returns, which complies with the above-mentioned ESGH, the environmental, social, governance, and health criteria. Going forward, we will provide fiscal and legal technical support to member states considering fiscal measures and other pro-health market shaping policies affecting health. The provision of subsidies or tax breaks for health promoting activities such as sustainable transport, exercise and sports participation, as well as the consumption of fruits, vegetables, and healthy diets offer tremendous opportunities to help consumers make the healthy choice. WHO supports initiatives to remove subsidies for fuels as well as those activities which harm the environment. The aim of this support is to provide an enabling environment to make the healthy choice the easy one. Finally, we continue to engage partners to promote collective action for health and well-being. An empowered citizenry is essential for people to enjoy the highest attainable standard of health and to make governments accountable for the health of their people. WHO will continue to engage partners in health literacy, strengthen participatory governance, and health in all policies in support of legal and fiscal measures affecting health, and help ensure that informed customers support an enabling environment for healthy choices. Dear colleagues, health is a compass for development and a barometer for a nation well-being. As money makes the world go round, we need to address main financial flows. To create a world that is better preventing a new pandemic to disrupt the world, the risks and their conditions need to be addressed. To develop a healthy economy, we can and must be supporting the industry and enable them to make the healthy choice. I thank you.
Thank you very much, Dr. Craig, for this very comprehensive, very clear overview and the linkage of so complex topics as economy, health, environment, and social justice. Thank you also for the invitation for the new party. We are going to be a part of this new party, of this participatory governance processes with our project. And I would like to explain to you what this project is about. Can you see the screen? Not yet, huh?
Yes.
Good. Okay. So, sorry, no. People, Planet Health is the project called that I'm going to present to you. And the slogan you've read on the invitation is, there is no health without planetary health. I think we all agree on this, but we are not going to be one of those projects that send out the number X call to the world, act and do something, because we are convinced that the process of change towards planetary health and human well-being has already started. It has started by a whole lot of local initiatives in all over the world who create planetary health and human well-being in small grassroots groups, in small initiatives and organizations to make a difference towards human well-being and planetary health. Some do this tackling both aims, planetary health and human well-being at the same time. For example, when people work for pesticide-free agriculture, they aim both human well-being and planetary health. Other projects may tackle health of people or health of the planet as a side effect. So, for example, when health promoting activities in cities to enhance social and psychological well-being of their citizens by urban gardening, they do something for people's well-being, but they also provide more biodiversity and provide more protection for the planet in a very small range. But this small range makes a difference. And this difference I would like to explain to you, because there are more impacts of planetary health initiatives on health, on human well-being. What these local groups do, they make a global threatening problem. Dr. Krecht talked about these global transitions. Climate change is one of these transitions. They make this overwhelming problem understandable to local people, and they help them to act on these problems. They make it manageable, understandable and manageable, and they enable people to take actions to tackle with these challenges. And thirdly, and most important maybe, they motivate people to get involved into these actions. They give these challenges a meaning, a significance, and make them worthwhile to engage for people. Comprehensibility, manageability, and meaningfulness are part of what we call the sense of coherence. And this sense of coherence has been proved in salutogenesis, which is the science about origin and maintenance and storage of health. This has been shown in decades of evidence, very important and predictive even for mental health, for social health, physical and psychological health, for health behavior, for coping with stress, for well-being and quality of life. So if you think your initiative might only be for planetary health. Think twice, because as long as you create coherence and as long as you create communities that include sometimes people that otherwise would stand aside, as long as you do this, you can be pretty sure that your initiative is health promoting and has a significant health impact. The problem with these small grassroots groups, is that they're not always visible. They're not visible to each other and they're not visible to the world. And this is what the People Planet Health Project wants to change. We want to make your initiatives, be they so small as ever, make visible. And we want to provide a platform that these initiatives, groups and organizations can connect, can network, and can learn from each other. Plus, we want to give these movements a more powerful voice. We have heard about global policies and we know about the gap between the small local initiatives and the political processes that are going on. And we would like to link you to these global processes. We will invite all participants in this initiative of the People Planet Health Project to co-create a position paper that will be sent to WHO to influence, to inspire a new global health promotion strategy. How this is done will be explained by Jake right now. I would like to end with a hope that the two movements will learn from each other, that health promotion will learn from planetary health movements, that human well-being is a priority, but not the priority by itself. It's a priority related to well-being of all other living beings and of the planet. So health promotion hopefully will learn to a bit step back with the priority of human beings, but not stepping back from the priority of health and well-being. On the other hand side, I would hope that the planetary health movement will learn from the health promotion movement that it's not very useful if we threaten with upcoming catastrophes. We will not mobilize people this way. We have learned in health promotion that agency for achievements, agency for positive goals, as Dr. Krech has mentioned, are much more powerful measures to bring in and to promote change. I thank you for your attention. You have here the contact details, and I will give over now to Jake, who will explain to you how you can participate in this project.
Hello, can you hear me? Anyone?
Yes.
Good. I'm trying to share my screen. Is it coming through?
Yes.
Excellent. Okay. Good afternoon, everybody. I'm Jake Soloway Costello from the University of Nottingham in the United Kingdom. And following Claudia's presentation about why you should be involved in People Planet Health, I'm going to explain the practicalities and the technical aspects of actually doing so. People Planet Health is a primarily website-based public health initiative. And so what I'm going to do over the next few minutes is just explain how the website works and how you can interact with it. You're very welcome to have a first look at the website. It's www.people-planethealth.com. It's a very simply designed website. It's gone through a process of international scrutiny using our sounding board of young activists and our advisory panel of more established scholars around the world. And so we've intentionally designed this platform so that it is as simple, as basic, and as accessible as possible so that people all over the world can share their stories using it. In terms of who should be submitting to People Planet Health, the answer in a nutshell is everybody. We want to hear stories from everyone and anybody who's got something fantastic to say about planetary health work, wherever they are in the world. I'm not sure if it's still sharing my screen properly. Is it still sharing?
Yeah.
Yeah. So we want to hear from individuals and groups, whether you are somebody that has an idea that you'd like to explore on your own, or whether you're part of a wider group organization, whether that's an incorporated organization or just a group of you and your friends. We want to hear about your ideas. We want to hear about them, whether they are local, they're something that happens in your neighborhood, or whether, like one of our speakers is going to talk about in a little while, something that happens across both regions, nations, and continents. We're interested both in ideas and innovation. So whether you're doing something right now, or you've just got the idea to get it off the ground in the future, tell us about it. You don't need to be able to prove that you're doing something to take part in People Planet Health. We want, even if they're just something that you've got in mind as part of a future action to undertake sustainable development. And we want to hear about both those actions and advocacies. So if you're doing something physical, I believe that our activist Jake Brown is going to talk about some of the things that he's physically doing. And we've also got two activists who are going to be talking about the advocacy work they're doing. So both the actions and the intended actions. We welcome both of those things. If you locate yourself to the People Planet Health website, you will find that there is a homepage which basically explains what we're attempting to do here. And Claudia talked a little bit about the theory of salutagenesis science, of the origins and maintenance of disease, and we explain here how planetary health helps to achieve salutagenesis, a reality for everybody. If you click on the button at the bottom of the page, it will take you through to the Submit Your Voice function. And on this page, we invite you to just take a very brief look at the broad eligibility criteria for people that we want to hear from. We want to hear from people who are creating sustainability in local contexts. That means that you are doing or saying something, or you have an idea about how you wish to do so to achieve planetary health. And you want to do that by involving local people. So you're giving a local context to those problems so that people can take meaningful, manageable actions to bring about planetary health in ways that make sense to them. And finally, difference. You have an impact. Your action, whatever it is, achieves something for planetary health. You don't have to prove any of these things. All we ask is that you abide by the simple rules that you're doing something and that it makes a difference with local people. Let's go down. In terms of what you would like to submit, we've structured this out in terms of 7 basic questions. If you follow to the bottom of the page, you will see the Submit Your Voice function again, having read the eligibility criteria. If we go through, there is a basic form, and all we ask is your name, an email address we can contact you on, your activity across countries or regions or localities, website or social media tags you would like us to promote. And then we go on to ask you these 3 basic questions. Essentially, what do you do? What do you achieve? And what would you like the future of planetary health and sustainable development to look like? These questions are as broad as you would need to provide your answers. So we invite you to write very much as if you were telling a friend. Remember that the more detail you give, the easier it will be for your idea to be tried and replicated anywhere else in the world. And so we really encourage explicit definitions and descriptions of the activities in which you are engaging. The more that you create effectively a recipe or an instruction or a protocol for whatever it is that you do, the more easy it will be for others to replicate your ideas and achieve your same planetary health impact. And so we invite you to tell them as if you were describing your ideas to a friend or close relative. When you submit your ideas through the Planetary Health, People Planet Health website, we ask that you simply fill in these 3 boxes and then click the submit button at the end. What will happen following this is that your submissions will go through to the IUHPE, who will engage in a very basic system of moderation. So they will simply check that you filled in the boxes and that we've got all the details we need in order to share your innovations and your ideas with the world. Therefore, we invite you simply to go to the People Planet Health website, navigate through the website, read just the very basic information which is provided, check that you are doing those three things, that you are achieving sustainable development by involving local people, and that you then go on to complete this form. What happens afterwards is that you will see your story added to our collection. We have here, you will hear in a brief while from representatives from the Uganda Youth and Adolescents Health Forum, the Real Junk Food Project Central in the United Kingdom, and the International Federation of Medical Students Associations. And we have shared their stories on this platform. So these are the verbatim quotes that were given to us using the platform form by our three youth activists. And what will happen is that your stories are shared through this website so that they serve as an example to others around the world. We will share your contact information if you are willing to provide it to us, your social media tags, and also showcase your website. And there are direct links so that people can enjoy them if they wish to do so. People Planet Health is a very simple public health international knowledge exchange initiative. And so we invite you to submit your ideas using the website. If you have any feedback about our website, we would also very much welcome any feedback, suggestions, or questions that you have. We invite you to get in touch with Claudia or myself if you have anything you'd like to say about it. We also finally invite further youth activists to join our international sounding board. You will see on the About page that we are building an advisory panel of established scholars who are helping us to distribute our project across the world, but we also want to build up a sounding board of early career professionals who can provide insight into what makes sense to young people, activists, change makers in the 21st century. People Planet Health is very much centered around the idea of creating a healthy, sustainable future which works for everybody. And so we're inviting contributions from people who are already helping to create that future. If you or somebody that you know would like to join our sounding board of youth, well, not necessarily just younger, but early career professionals who might have that insight to provide vision into what a healthy, sustainable future looks like, please do let us know. I very much look forward to seeing your contributions to the People Planet Health website. And if you have any questions about the website at the end, please do let me know. I'm now going to pass over to, I believe, Leanne to introduce our three young activists. So I'll pass over to Leanne.
Hello, everyone. So it's my pleasure to introduce the next speakers, and you will hear directly from engaged youth on why they are joining this project and what they hope to accomplish. So without further ado, can we hear from, we'll do a slight change to the program here and go to Jake Brown from the Real Junk Food Project Central UK, as we're having some connection issues with Winnie. Thank you. Please go ahead, Jake.
Good afternoon, everyone. Can you hear me okay?
Yes.
Okay, I'll just share my screen with you all. Oh, sorry, Jake's doing that for me. Brilliant. Okay, so my name's Jake Brown. I'm a social entrepreneur, and I couldn't agree more that community groups have already begun creating planetary health. I currently work with an organisation called the Real Junk Food Project Central. And this is a relationship and a connection that came about because I started a very similar project whilst I was at university called Utilise. So what do the Real Junk Food Project and Utilise do? They are both local, volunteer-run community groups that divert waste or surplus food from landfill. And they serve and sell this on a pay-as-you-feel basis, which means all that are welcome. And what do I mean by that? I mean that you can pay with cash, you can pay with skills, you can pay with time, you can pay with imagination. It includes everyone. And why I think local groups and local community groups are so special is they're so well positioned to provide value. So they're quick and easy to mobilize, quite often with very limited resources, but they still produce high levels of social value. And often this social value is very tailored and very responsive to the needs of the community in which they serve. And I believe that quite often bigger organisations with perhaps more bureaucracy and red tape would struggle to achieve this. So what does the Real Junk Food Project achieve or hope to achieve? Well, we want to reduce food waste. We always say we're the only business that wants to go out of business. And what do I mean by that? I mean that our business model relies on food waste to deliver the value that it does. But we'd like to eradicate that problem from the UK and ideally the world. So we educate our suppliers and our consumers on how they can reduce their own food waste in the hope that one day we achieve that. But whilst food waste exists and it's still here, we seek to utilise it. So we ensure that all those who have a hot meal, who need a hot meal, have access to one, and we deliver that in a community space where people feel welcome, where they feel safe, and where they can socialise. And we do this whilst generating sustainable revenue so that we can continue to grow, continue to operate, and continue to serve our communities. Something notable about both the Real Junk Food Project Central and Utilise is the importance of networks to these projects. So both projects are part of the umbrella Real Junk Food Project network, and especially for Utilise, this was absolutely instrumental in getting off the ground. It really helped fill the skills and knowledge gaps that we had. So they taught us about things like public liability insurance, health and safety, food hygiene. They gave us connections and links to suppliers. They even lent us resources for our first few cafes. So they sent us some food and even a couple of volunteers to help get us started. Another network that Utilise was part of was the Enactus Network. So this is a university-based group at various universities around the UK. And through this, I was able to strategize and develop ideas and share best practice with a variety of social enterprises and other community groups. And in the same way that the Real Junk Food Project helped get Utilise off the ground, we at Utilise were able to help numerous other cafes related to other universities get started by sharing knowledge, sharing best practice, etc. So the third and final question that this relates to is what's my vision for the future? Well, I hope that the Real Junk Food Project is just one of countless organisations all working towards common goals, and that each of these organisations are able to support each other, make connections, share ideas. And what really excites me about People, Planet, Health is I see that this is a way and means in which this can be achieved. So I'm able to see and connect with other like-minded individuals and other organisations all working towards planetary health, which makes my vision of the future all the more achievable. Because as we've said, we create health with planetary health, and I believe that planetary health is something that we achieve together, not on our own. Thank you very much for listening, and I hope you enjoy the rest of the webinar.
Thank you, Jake. That was nice and short. Thank you for that. We are still having connection problems with Winnie. I think we will try to find a way to share her contribution in some way later on, as this is proving difficult. But we can hear now from Omnia El-Omrani, International Federation of Medical Students Association in Egypt. Over to you, Omnia, please.
Yeah. Can you hear me?
Yes, we can hear you.
Perfect. So just one last confirmation, I'm sharing my screen.
I can see the screen.
Perfect. So hi everyone, I'm so happy to be with you today. I'm Omnia El-Omrani. I'm a final year medical student from Cairo, Egypt, and I'm also part of the International Federation of Medical Student Association, the IUHPE-UIPES. I'm the liaison officer for public health issues, so basically the focal point for all our planetary health and climate change efforts. So I would like to just briefly explain to you what does our organization do. It's a federation of 1.3 million medical students from from 129 countries worldwide. And we have been there since 1951. So next year is going to be our 50th anniversary. We work closely on a local and on a global level, globally with the UN, with the World Health Organization in a diversity of global health issues. And climate change and planetary health has been one of our main global priorities for the past years. And our vision is to create a world with a better and a healthier future, both human health and planetary health. So what does our organization do? Very briefly, and I have submitted our efforts through the website of People Planet Health. So I would like you to also check it out. So basically, as medical students, we are also the future health workforce. And our duty of care does not just lie to our patient, but also to our community. That is why we started by building our own knowledge and our own understanding of what planetary health is and how is human health and planetary health linked. So we collaborated with the World Health Organization and we created a training manual to build the capacity of our members on climate change and health. And then we developed and conducted many workshops and training sessions on climate change and health in many countries, including my own country, Egypt, as well as Ecuador, Peru, Canada, Slovenia, Rwanda, and many more. And then we also developed a program within our organization that serves as a database for all the activities that our members do locally, worldwide. And you can see the list of activities on our website if you want to learn more about it. And this database helped us to create a map that has examples of what medical students have been doing around the world. So for example, in Egypt, our members have been conducting a project where they help vulnerable populations access safe water in Cairo. And then on the other side of the world, in Colombia, medical students have been planting trees as well as raising awareness to their own community on the importance of having green areas as well as the disadvantages of deforestation. While on the other hand, in Australia, our medical students have been working closely with their governments in order to integrate health in their climate action plans. And then if you go back to Indonesia, medical students have been going to secondary schools in order to raise awareness about the dangers of air pollution. And these are just a few examples of what our members are doing worldwide. And then our advocacy does not stop here. We also make sure that our meetings are climate friendly and sustainable because we do a lot of workshops, a lot of sessions, and we want to make sure that they have the least carbon footprint. And then we also want to we act locally, but we also act on a global level. And we do that through our policy documents, which are our tools in order to advocate. They are all adopted by our 129 member organizations on a diversity of topics related to planetary health. We have climate change and health, we have air pollution, health emergencies, food for health and sustainability, and many more. And then we also, using these tools, we go to international conferences like the Climate Change Conference that takes place every year by the UN. And we go there with a delegation, we talk with the government representatives, with ministers and so on, to advocate for climate change and health to be a priority and to also make sure that our voices, our stances as youth is heard. And as you can see, we do a lot of actions during these meetings, we deliver statements, we distribute advocacy briefs. And then finally, we also want to make sure that it's not just us, members of IUHPE-UIPES, but medical students worldwide are learning about planetary health and climate change in their own education. That is why we conducted a global survey spanning more than 118 countries, and we identified that only 15% of them have a mention of climate change in their curriculum. And that is why we are now working on integrating this knowledge in our education. So finally, what is our vision of the future? As Jake said, we create health by planetary health, and this is really important. But also we cannot create planetary health without the meaningful engagement of youth who are responsible for the future and for the health of this and the future generations to come. So we need to build a future together, us with the policymakers, with all civil society members, to create a healthy and a sustainable world in the light of post-COVID recovery. So thank you so much. I hope I was brief enough, and thank you.
Thank you so much, Omnia. Yes, you were nice and brief and thorough at the same time. It's excellent. I'm waiting to see here on the live chat if there are any questions. Okay. Someone would like to be involved with the project. When will they be eligible? Or I assume this means when can they start contributing? Maybe Jake can answer that question.
Sure. So we're welcoming contributions from now, I guess. We have the first 3 uploaded and ready to go. In terms of eligibility, I mean, it's probably not quite the right word that I use, but we just want to invite anybody who is doing something planetary health related and has an impact, or maybe you've got an idea that would achieve the same outcome. So I guess everyone in the world is eligible for as long as you are doing something good for your environment and or something good for your health. But please do start getting your stories in immediately.
Wonderful, thank you. I'm having issues now with Patricia being cut off Zoom. And I wanted to ask her if there were any questions from our YouTube followers. There's a question for Omnia in the meantime. Are there medical doctors from Botswana in your organization? So perhaps Omnia, you can respond.
Yes, so we don't have a member organization there, but we would really love to engage all the medical students in there. So I will leave my email and please contact me and we can see how we can establish also a student organization in your country.
Okay, great, thank you. Thank you. Okay, I don't see other questions on the chat here, and I don't see anything coming through text no, she says there are no questions currently from our YouTube participants. So in that case, if no one else has any comments or questions, that's fine. If you have some, you can continue to write them in the messaging and we can take that into account as we continue to communicate about the project. But if not, I will go back to Claudia for some closing remarks. Thank you, Claudia, go ahead.
And I would like to add what Winnie would have talked about and to invite you to go to the website and read what she was talking about. She links women's health, gender health, sexual health, and climate. And this is a very important linkage, and I really invite you to go and read the contribution of Winnie, who has problems accessing this webinar. Before Dr. Craig will do the closure of this webinar, I would also like to invite you to go on the position paper button on the website. There you will see a Wordle. Automatically, your contributions will generate a Wordle, and this Wordle will be the basis of the writing process you will be invited to from autumn, we think, for a first position paper inspiring the higher or the global policy. Thank you, and please, Dr. Craig, it's yours.
Thank you very much, Dr. Maya Magistrati, and I really would like to thank you, first of all, for organizing this, this webinar. Because in health promotion, we're always global. We're looking at global events, and then we're looking at local applications. And this webinar today has shown very well how we operate in health promotion. And I'm really grateful to the contributions. Jake, I think the website and registering projects on planetary health as such is an excellent idea. And the 3 examples that you've given, or the 2 that we could actually see, are very, very well placed. You see, it is everybody's business. It's not somebody else's business to create a healthier world. And I think this crisis, this COVID crisis, shows us very well what will not work in the future. And so therefore we cannot leave it to those who have organized this before, but we need to engage. We need to show a different way, how we can make societies more sustainable, how we can actually include people much more in the way we organize our local communities, and how we actually produce well-being. And Jake, in this project of the Real Junk Food Project Central, you're showing how this can work. You will have so many bigger returns on what actually you're putting in, like the real junk food. You will get a lot out of this project, I'm sure, and I really would like you to let us know how it proceeds and how many cities you will actually be able to expand the cafes and do exactly what you've shown there. And then, of course, the International Federation of Medical Students Associations, you're friends of ours in WHO, you're partners for many, many years. And it is actually the future medical doctors as well who can then reorient the health service and health system. And that is what I would like to end up with. Thanking you again, Dr. Maya Magistretti and IUHPE for organizing this. The future is in all of us. It's the way we actually take things in hand now and make it a reality that health is central to development. As I said, it is a seismograph. It's a barometer for nations' well-being. And if we actually use health promotion instruments, we will raise to the bar. We will actually make it possible that we will no longer and never again see a crisis like this. If we were not successful with it, we'll see a next crisis. But I'm very hopeful with this today's event and many more people coming in and showing us the way forward. So thank you very much, Dr. Maya Magistretti. Back over to you.
Hi, I just want to say that there was a question about a deadline. There is no deadline as such. Jake has said that we envisage to receive some submissions over time, but his recommendation is basically to submit as soon as you are ready. Not all might make it into the position paper, but they are still welcome while we keep collecting them. If you want to add anything, Jake or Claudia, about the time frame for this.
There is no specific time deadline envisaged currently. However, I would just reiterate whether or not you submit your contributions prior to the writing of the position paper, the primary aim of People Planet Health is to share and celebrate ideas and innovations. So those we can share whenever you choose to submit them.
Okay, thank you. We have, if in case people aren't following the chat, we also have a comment from Alva Godfrey saying that there are links between this or similarities between this and the EuroHealthNet project, and she is linking to that project in case people are interested in finding out a bit more. But I see no further questions as such. So if that's that, then I will thank everyone, our speakers, Claudia, who's pulled us all together to organize this, and all of our participants here on Zoom and YouTube. So thank you very much, and have a great rest of the day or night, wherever it is that you are. Thank you.